Health risks. Young children are at a greater risk of various infections and diseases. So we all know that young children, they are more prone to getting diseases and infections. Schools have the responsibility to educate their students and foster among them healthy and hygienic behavior. So all the risks that are there, very obvious for the parents and the teachers, they have an understanding, and they do have an understanding that the young children, they are more prone to get the infections. So they need to inculcate and make them understand what are the things they need to do when they are getting some disease or a viral infection, or getting involved in some kind of an activity which is causing them some disease or sickness. So by this understanding, this health education can be imparted in the classrooms along with the teaching of other subjects, and the students, they need to be aware of all these infections that can cause some kind of illness in them. So because it is very important for them to control the disease, the teachers need to work on a school health program while they are teaching other subjects as well. So the students can be informed how they should be using napkins in order to avoid any spread of further germs in the classroom. Also, the students should be told to cover themselves properly during the winter school time, because sometimes the teachers do not really instruct the students to wear proper clothing for summer or winter, and therefore the students, they tend to get infections, and also there is a risk of further illness. They need to warn their students about various health risks. That is, that they need to tell the students that because it is very hot or because it is very cold, there is a possibility of catching an infection, and therefore they need to use those materials which are good for the particular season or weather. And that will be more effective than the parents guiding their children, because usually when it comes from the school, the children, they tend to obey it and follow the instructions given by the school. So the teachers need to warn them what is going to happen if they do not follow those procedures. Also, the teachers need to tell the students, for example, that they must have healthy food at home. The parents must also cooperate with them. It has been noticed that most of the students come without having breakfast from home. Sometimes the parents are negligent about it, and this causes a lot of weakness and disturbance for the students to come and start a fresh day in school and learn something. So the parents also need to cooperate with the teachers to take care of the health of the students. Also, there can be a risk of some digestive problems if the students are not eating well, or if they are not eating food which is good for their growth. In that case, again, the teachers need to inform the students that it is very important for them to get out of this risk of getting sick or having digestive problems because of eating junk food, or because of eating food which is not good for their health, or because of just neglecting their meals and not eating anything and coming to school without having breakfast. The teachers need to guide them how to protect themselves and others against diseases and other forms of ill health by adopting health and hygiene promoting habits and practices. So all these practices need to be displayed on the notice boards as well and instructed by the teachers. Again, not only the instruction of the teachers is important, but also the follow-up by the school, the community and the parents' cooperation will make it possible for the students to understand what are the risks to their health, how they need to avoid those risks, how they can keep away from a disease, how they can take care of their bodies so that their physical abilities are in place and their growth is taking place as a normal person, and the diet they need to take has to be taken care of as well.